Good morning, everybody. Welcome to this week's episode of Tooth Teacher Tuesday. As always, I am your humble host, Dr. Steven Zahm, and today discussing a question or really just commenting on an aspect of dentistry that comes up a lot with patients that, um, certainly in my office, my patients have become familiar with this. Um, I would like to think that every dentist out there is doing this, but not necessarily. But basically, the question is, you know, obviously you're my dentist. I'm here to see you for my regular checkups, and it makes sense that you're checking my teeth for any cavities and checking, my gums and other soft tissue in my mouth for gum disease, checking for oral cancer or other oral pathologies. But the question is, why are you checking my, you know, head and neck area? What does that have to do with dentistry? And so, yeah, like I said, my patients have become familiar that with our, regular checkup exams, part of what I'm going to check is along the chin, along the neck. A lot of patients jokingly refer to it as their free neck massage. Um, but very important part of the dental exam and what we're checking for when we do that is certainly stuff related to dentistry, like, is there any knots or tenderness or anything with our chewing muscles? We've got chewing muscles, all the way up from our temples, down along the sides of our cheeks, and even down into our neck. And so, as we've talked about in previous videos, if those muscles are tense or painful, that could be a sign of some kind of TMJ disorder. So that's one thing we're checking. Another thing we're checking is for any unusual swelling, any lumps or bumps along the chin or neck that shouldn't be there. Um, one concern if we do find a lump or a bump would be that we've got swelling of our salivary glands that kind of rest underneath our tongue and then even up into our cheeks. That um, any swelling with the salivary glands, again, we've talked about in past videos, could be a sign of any number of things from, just simple mumps to blocked salivary gland to some kind of salivary gland tumor. Um, so if you find a bump, don't panic, but definitely check with your dentist or doctor. But that's one thing we're checking. Other lumps or bumps that we could find doing our head and neck exam would be, things unrelated to dentistry that we can at least kind of pre-screen for and get you in with the proper doctors. But other lumps and bumps in the neck could be with the thyroid gland, which is kind of a bow tie shaped gland that sits right here on our neck, kind of over our voice box. And um, I think many people are familiar with the thyroid gland when it swells up and becomes a goiter. That is a sign of some kind of dysfunction with the thyroid gland, and so you'd want to get in with the proper doctors to treat that. Um, and then also, likewise, feeling any lumps or bumps along the neck, those lumps or bumps could be a swollen lymph node, which, our lymph nodes are just kind of a whole chain of, highway through our body that they just run all along the body, and they're part of our immune system. That if we have a swollen lymph node, again, that tells us that our immune system is hyperactive for some reason. A lot of times when we find a swollen lymph node, usually patients tell me, "Oh yeah, I just got over a cold or the flu or something." Um, so simple illnesses like that can cause the lymph nodes to swell. But then also, again, at the other extreme end, swollen lymph nodes could be a sign that there's cancer in the lymph nodes. And again, cancer can spread along the lymph nodes, use that highway for cancer to spread from one organ to another. So um, again, finding a lump or bump doesn't automatically mean it's cancer. It can mean a lot of things, but certainly certainly something out of the ordinary and something we'd want to investigate further. Again, even though we as dentists can't treat thyroid disease or treat anything that would be causing swollen lymph nodes. Well, I guess I shouldn't say that. Swollen lymph nodes could also be a sign that you have some kind of dental infection going on too. If you think about it, you've got an infected tooth here. It wouldn't be surprising for that infection to cause your immune system in the area to act up and have some swollen lymph nodes along your neck. So, again, it's just a sign that something out of the ordinary is going on, and making sure that we get to the bottom of that so that you can be treated properly. But so if you ever go into your dentist and they perform a head and neck exam like that, it's again not something that is normally going to be something that's part of regular dental treatment as far as if we do find something, but just again another good screening measure, and especially this has become important in these years following the COVID-19 pandemic, where just a lot of collaboration between all branches of healthcare, dentists watching out for doctors, doctors watching out for dentists, just more collaboration that in the end is all in our patient's best interest of, just that good communication, that if one of us spots something that the other can treat, just getting the proper referrals. So, that is why your dentist may or may not be doing a head and neck exam. And so, hope this was enlightening. And like always, if you have any thoughts for future episodes or any questions about today's episode, feel free to comment below. Otherwise, I'd like to thank you for the pleasure of your time, and I hope you'll join me on next week's Tooth Teacher Tuesday.